portion of the program is going to begin shortly, but before that, as I told you, we want to give you a little report of the business and our accomplishments, and Carol Langer, our treasurer, is going to do that. So if you could take a minute or two to find your way to your seats, we would appreciate it, so we can keep moving.
Many of you know me as the person who talks about caregiving, but in my day job, or what used to be my day job, I am an accountant. So I am also the treasurer of the Multiple System Atrophy Coalition. And I understand there have been some questions about finances and numbers and things like that. So I am going to give you a gray line bus tour through the MSA Coalition finances. Alex, are we okay on this? Almost. Okay, 2 more seconds. So last minute decision to live stream this little presentation. I can start the back. Should we like Japanese financial statements? So you'll notice it says 2016 financial review because this is based on public records that you can look at, the 990s that have been filed. And our year end is December 31st, so we are well into 2017 at this point, but we don't have audited numbers for 2017, so we're looking back a little bit. But I think this will answer a lot of your questions. Okay, so if you look at this slide, you will see that we are growing. We in 2012 we had a top line of $54,000. We had a high point of just over $1 million in 2015, and that was largely due to some corporate contributions. And then we're back at $862,000 in 2016. So it's quite a leap to go from 2012 to 2016. Yeah, and this is all. This is we have obviously enjoyed contributions from a couple of corporate sponsors. Lundbeck in particular has been very generous to us, but most of the money that we raise comes from, I feel like PBS, comes from people like you. Because, and it's grassroots fundraising from grassroots people who care about this disease. Okay, and we're spending it wisely. I hope we are. I think this may have been mentioned earlier. We have no paid employees at the moment. We certainly, I hope to change that because we're at a size now where we're kind of stressing the edges here. We have a lot to do, and it's hard to do it with all volunteer time. But I'm not going to go through all the details here, but the important thing to see is the stuff that's in purple, because it's the color of MSA. These are what are known in the income tax reporting world as program expenses. We spend very little money on management in general, which is this blue, and hardly any money on fundraising. Our fundraising expenses are basically credit card fees. We don't employ any professional fundraisers. So virtually everything we spend is on meeting the needs of our patients and caregivers. And I thought you might want to know a little bit more about program expenses. So you see that the lion's share of our program expenses, and we began our research grant program in earnest in 2014, where we gave out $244,000 in research grants. In 2015, we awarded $483,000 and just over $500,000 in 2016. One of the things I have learned through another organization that I am active with is that a dollar spent in what we call seed funding yields 5 times that once a project reaches proof of concept. So we can't compete with NIH. We're not trying to compete with NIH, but our funding for research is in the very early stage concept type of things. And I don't expect you to read the details of this pie chart, but I did want you to see where we've awarded our $1.24 million. $1.24 million of your money, really, in research to 17 respected institutions that are all doing work on multiple system atrophy, trying to find the cause, biomarkers, and hopefully a cure. We've got a healthy balance sheet. You will see and probably be surprised by the fact that we ended 2016 with a lot of money in the bank, over $1 million and $814,000 in our research fund. Why, you might say, do you have so much cash? If you look down here, you'll see that at that point in time, we had promised $266,000, $267 almost, of that already. And when we go into our grant cycle, we will not entertain grants if we don't have the money already in the bank. So we stockpile that cash, and then we award it to people who are doing great work. And last but not least, we are, in 2017, a top-rated nonprofit. That's a grassroots vote from people like you. Again, I sound like PBS. And we are also a GuideStar Platinum participant, and it is brand new. We were gold before, now we're platinum, and they particularly awarded us this for our transparency. So we try to be as transparent as we can be. And if anybody, speaking of transparency, if anyone has any questions about any of these, I'm happy to answer them. I don't want to bore you with excruciating financial details, but I'm happy to answer any questions either now or offline. I'm glad you asked that question. We love to have people do fundraisers. Don, are you the contact person these days for that? Yeah. We will give out T-shirts. We give out. We'll send you the banner. We have worked up some guidelines on how best to do that, and. Thank you very much. So this yesterday's session that's available on video. You can look at that. Okay. And there's lots on the website. The website, by the way, we're in the midst of revamping. So our website's going to get better. Okay. And with that, thank you very much. I hope I didn't make you crazy. Turn it back on again.
Oh, thank you. Yeah. All right, well, speaking of fundraising,
there you go.
for the time, I just wanted to.
Happy to help.
So a couple of people heard when I was saying that I am interested in making some MSA Coalition or MSA awareness cycling jerseys. A couple of people had expressed some interest. I'm actually going to go work today on getting that design done and finalized in the next few days, and get a website up on the manufacturers. They'll give us a page on their site. So if you are interested, pay attention. Just keep an eye on the MSA Coalition Facebook page and or Twitter feed, and if you want to express. If you want to, me to contact you directly, you can email me, nversel, N-V-E-R-S-E-L, at msacoalition.org to express your interest. So that they'll be priced about $80, give or take, plus shipping, which is not bad for a custom-designed cycling jersey if you're familiar, if you've ever bought one before. And the more we sell, the higher percentage of the sale price will go to the MSA Coalition. So. Just wanted to put that out there, and please get in touch if you're interested. Pull me aside or email me and or watch our Facebook and Twitter for more information. Thank you.
Thank you. Particularly grateful because she's not only happy to come here and work with this community, but did so on rather short notice. So we're really, really happy to have him speak to you about some of these options. So Dr. Chevelle, I will turn it over to you. Thank you. Whichever you prefer. If you're going to just don't wander too far because of the videotape.
Okay.
Okay.
Yeah, so, perfect. Thank you so much. And again, thank you all for having me here. I'm very grateful to be here with you, and especially on this short notice. And I'd like to send Dr. Birdie's regards and his condolences for not being able to be present. But so today I'm going to be talking about specifically mind-body practices and how they may be relevant in the management of chronic disease, specifically with some attention to the modulation of autonomic tone. So I have a few objectives for all that I hope you will all be able to achieve through this talk. One is to be able to describe major mind-body medicine sort of overarching principles, have some awareness of different practices that are out there, and also an understanding of some of the primary mechanisms that we think are associated with these practices, again with some extra attention to the modulation of autonomic nervous system functioning. And also I hope to talk about some different treatment modalities or treatment models, so how you all or how you might be able to advise people to seek these different services out. And time permitting, I have some little tips or pointers to think about when looking for some of these different practices as well. So first, some general overview on mind-body practices and mind-body medicine. I'm going to be talking a lot about different interactions that are important to these systems. So one of these is the influence of the body on the mind or the mind on the body. So an example here might be stress. If any of you have experienced something stressful before, maybe you have, you might notice that there are some changes that go on in your body. Maybe you notice that you start sweating, your heart rate changes, your respiration changes, things like that. And likewise, the effects of processes in your body, your physiology on your mind. And I'll talk more a little bit about specifically what I mean for each of these terms, but another example here might be exercise, or even, I would say, movement in general. Perhaps you've noticed if you get out and exercise or move, it doesn't have to be vigorous necessarily, that you might notice your mood improves. You might notice you feel a little bit better, or at least different in some way. And so mind-body medicine and mind-body practices really consist of specific techniques that focus on these different interactions and that attempt to utilize our awareness of these interactions for the improvement of health. And so I want to expand that model a couple times a little bit and add in some important elements as well. So as we talked about, we have the body, the mind and the body, this reciprocal or bidirectional relationship that I just mentioned. And also we can think of the influence of the breath. And this is a common sort of philosophy in a lot of different mind-body practices that we see, is focusing on the breath. And I'll give you some examples of that as well. So one might be if you start moving your body more, maybe you're, again, exercising or moving around, you might notice that your breathing changes, maybe breathing faster. Or maybe if you're stressed, as I mentioned before, you might notice that your breathing changes as well. And so a central feature of a lot of mind-body practices is sort of the reverse of this coin, is that through attentive and intentional regulation of our breath, we can affect the functioning of our body, our physiology, and also our mind. And in talking about our mind, I mean a few different things, and I'm going to, again, expand this model a little bit more. And I hope, at least in doing this, I can maybe demystify some of what mind-body practices mean. I know that's a term that's thrown out a lot these days, or, integrative medicine and mindfulness and all these different things, so I hope to clarify some of that. But specifically when we're thinking of the mind, a couple areas that I'd like to highlight, one is our cognition, so our thoughts, and also our emotions. And so our thoughts being, our thoughts really, but how we evaluate our experiences, the things that we think of, the expectations that we have. And also our emotions we can think of as almost the valenced reaction we have to these experiences, whether it's something is positive or negative, pleasant or unpleasant, and also how that influences our behavior. And a simplified way to say this is whether we want to approach something or avoid it, to move towards something or move away from it. And so with mind-body medicine, we really try to focus on all of these different areas and all of these different interactions to identify new processes or new ways that we can intervene to improve health. And so here's a little bit of a more formal definition for you that mind-body practices, again, and I'm going to sound like a broken record maybe at the end of this talk, but we focus on these different relationships. We focus on the influence of our mind, of our bodies, our thoughts, our emotions, brain, behavior, and numbers of other different systems and processes to hopefully mitigate suffering, but also improve health and improve functioning. And another little historical note, and I apologize if this is cut off a little bit, but historically these practices have been considered complementary or alternative medicine, and I'll break that down a little bit. So complementary medicine was used to refer to the application of these practices, things that weren't part of traditional medicine, in tandem with traditional medicine practices, so as a complement. While alternative medicine was used to think of these things as alternatives to more traditional or standard medical approaches. And more recently, we've been moving to this model of integrative medicine. And I'll talk about that more in some detail a little bit later, but I want to highlight and emphasize that integrative medicine refers to the integration of all of these different practices, all these different systems of thought and philosophy with the hope of helping the person as a whole. And so with these integrations and the increase in application of these practices in our healthcare system, we've also seen increased research and increased research evidence on the influences and effects of these practices. And I want to talk a little bit broadly about some of these, themes of research that have been out there with things like healthy lifestyle factors, the processes we use to live our lives, our behaviors in doing so as well. Stress reduction has also been a key concern, a key element for a lot of this research, particularly in the context of chronic illness. And again, I'll talk about this a little bit more. And so here's a slide that has a lot of different examples of mind-body practices. And I want to highlight a few things from this slide talking about a few of these, and I don't want to sit here and list through each of these, but something I'd like to highlight is that mind-body practices, when you think of practices or systems of thought or philosophy that utilize these interactions, we see them showing up in most, if not all, cultures across the world and across history. And so I say that to indicate that this really isn't an exhaustive list by any means. You may think of mind-body practices that are applied in different cultures or identities that you might have, or historical parts of the world otherwise. I think currently there's been a lot of attention and focus on the integration of Eastern or Asian movement systems or philosophy into healthcare and into medicine overall. And that's not to say that those are the only sorts of practices. They happen to be in some ways very popular right now, but also have considerable research evidence backing them. And also some of these practices that we might see up here, you might not traditionally think of as mind-body practices or as part of whatever you might associate with mind-body medicine. Something that I like to highlight is prayer. Things like nutrition, weight management, sleep hygiene, or behavioral sleep medicine. So adjusting how you interact with sleep, your patterns and habits and associations you draw with the bed and the sleeping environment also fall into this larger umbrella of practices. So I want to start also by going into some depth about a few of these areas or elements of practice, and starting with mindfulness here. I realize that this is a term that gets thrown around a lot these days. We see it on the covers of magazines, on TV shows. People are talking about it, and on NPR, the radio, all sorts of things. So we throw this term around, and there's a lot of hype, and I hope to at least be able to clarify what we mean by this. And I think this little cartoon here can be sort of helpful in doing so. You see this person and his or her dog walking through, let's call it a park. And you can see these different thought bubbles illustrating what these two individuals are experiencing in the moment. We see this person here with, let's see, what do we have here? Maybe bills to pay, cars, places to go. Someone's very unhappy, it looks like, a TV remote, sounds, noises, all these different things. And, maybe some of you can relate to this experience, but in fact, probably most of us can. And on the right side, we have the dog who's simply enjoying the park. And so this may sound like a tall task, but in some way what I'm trying to communicate with mindfulness is that we're trying to make you more like your dogs. But specifically, what does that mean? And so this is the definition of mindfulness, or a way we can think about it by Jon Kabat-Zinn, who's the founder of mindfulness-based stress reduction, which is an incredibly well-researched protocol for the application of mindfulness in the mitigation of suffering and distress for chronic disease. And I'll talk about that a little bit more. But so Jon Kabat-Zinn talks about mindfulness as having a number of elements. And the first of these is paying attention in a particular way. So attention is key. And I'm going to keep bringing you back and talking about attention. So paying attention in a particular way. So paying attention on purpose. And what I mean by that is we're intentional about where our attention goes and how we guide it and regulate it. An example of this might be driving. If you've ever gotten into your car, you're going somewhere, or maybe you're the passenger, you get in the car, before you know it, you're there, wherever you might be. And you have no idea what happened on the drive. You don't know what the weather was like. You don't know if there are lots of cars. You might know that someone was following you a little bit too closely and you didn't like that, things like that. But you really didn't have much awareness of what was going on around you. You can call this autopilot. And so that's an example of not being mindful. And so paying attention on purpose means that you're at least aware of what you're thinking about. And there's some sort of intent and maybe hopefully value in where you're choosing to place your attention. Another thing here is that this paying attention on purpose is done so in the present moment. So it's not so much a focus on the past, whether we have memories from the past that are pleasant or unpleasant. We certainly can have both. Or on the future, things that we might have to do, things that we're anticipating or maybe not looking forward to. These could be, again, pleasant or unpleasant things. But the principle and the philosophy here is that we're grounded in the present moment, in what's here around us now. And then the last core element here is doing all of these things non-judgmentally. And this one can be tricky because it refers to judgment in a few different areas. So one, non-judgmentally in terms of what's going on around us, but also in terms of our own internal experience. Whether we have thoughts or emotions, memories, sensations in our body that are unpleasant or things that we don't want, we're holding these things in a non-judgmental way, which admittedly can be very difficult, and that's why this is a practice and not necessarily an intervention. And so I think mindfulness can have a number of benefits if we think about it in the context of life and stress in general, but one of these is that it can help foster the capacity to hold our experience in a non-judgmental way. So it can foster willingness to whatever our experience is, whether it's pleasant or unpleasant, because although we certainly would like to not have difficult things in our lives, sometimes we can't control that. And so this system of thought and system of really experience can help facilitate that sort of practice and awareness. And so I also want to talk about a few different types of mindfulness exercises and highlight one thing about mindfulness in general is that oftentimes in our culture now we think of mindfulness being sort of related to systems of Buddhist practice or Asian, Eastern philosophy, but these sorts of contemplative practices have shown up in numerous different spiritual religious traditions. I can think of very clear examples in Christianity, Judaism, Islam, in numbers of different religions. So when you think of mindfulness in healthcare settings, it's more a secular application of these same principles that we find in a lot of different cultures. But anyway, back to types of mindfulness practices. So the first type I'd like to remark on, and this stuff isn't really on the screen, but one is focused attention. And what I mean by focused attention is that the onus of the practice is really guiding your attention on one aspect of your experience. So it might be on different sensations you notice in your body, maybe systematically moving through what you notice, feelings, sensations in your feet, moving up into your legs, your back, your abdomen or stomach, and so on. And we can think of this as a body scan or progressive muscle relaxation. And again, the focus isn't on trying to change any of those sensations or things you notice in your body, but simply experiencing them and being aware of them. Another example might be sitting meditation. And this is sort of what we might picture when we think of mindfulness as someone sitting with their legs crossed in a very uncomfortable way and being very quiet and serene. But a way to break this down is just thinking of focusing on your breath. And it might have you try this out in a moment as well. Another example might be walking meditation or different movement types of systems, and I'll talk about these a little bit more, where the focus, again, if we think of this as a focused attention practice, is on being aware of one aspect of your experience. Maybe it's the feeling of each step or your foot rolling as you walk or the sounds of nature, things like that. Another example might be mindful eating. Oftentimes the practice of eating or eating our meals is something we do mindlessly, maybe in front of a television or while talking, and you may have had the experience of sitting down for a nice meal and recognizing after that you didn't really taste it. And so mindful eating is really putting our awareness back into the process of doing these things. And so just to give you all a small snippet of this, if you're willing and interested, I'll walk you through a very short sort of mindfulness of the breath exercise. And in doing so, if you're comfortable, again, completely voluntary, I'd ask you to find a comfortable place in your seat. If you're comfortable closing your eyes, you may do so. If that's not comfortable, I would encourage you to find some point. Maybe there's a spot on the floor, maybe the chair in front of you. I recognize that this is dangerous to do after lunch, but we'll go ahead and try it anyway. And so again, either your eyes are closed or they're focused on something in front of you, so you have some sort of focal point. And as you're doing so, I'd just invite you to notice whatever you brought into the room with you today. Notice whatever motivations, values, interests, maybe pain or suffering that brought you to be here with all of us today. And simply acknowledge those things, whatever journey you may have taken to get here. And I also invite you to draw your attention to your breath. Perhaps noticing with a sense of curiosity what it feels like as the air moves past your nose or your mouth as you inhale. And then noticing again that same air moving out as you exhale. Perhaps guiding your awareness to the sensation of your lungs and your abdomen expanding. Perhaps you notice your back pushing against the chair as your body expands with each inhale. And then as you slightly deflate with each exhale. Noticing, too, any reactions you might have to this exercise, any thoughts that come up. Perhaps you find yourself getting distracted, your mind wandering. That's what minds do. And so you noticing that is in some way a victory. So I invite you to take another couple short breaths. And as you're ready, open your eyes, maybe wiggle your fingers a little bit, move your toes, and come back to this room in this presentation. And so I wanted to go through that exercise for a few reasons. One, it gives you a little bit of a taste of what this means or what it might be to be guided through an exercise like this. And maybe you got a bonus, very brief nap after lunch, and that's great too. But another reason behind doing this is that with a lot of these practices, and mindfulness specifically, we can talk about them. And there are all sorts of books written and lectures you can go to and things you can watch online and YouTube, and you can hear people talking about it like I am right now. But the main focus is on your experience in doing these things. The main focus and the main benefit is from the practice. It's from your experience. Whether you have racing thoughts or your thoughts are very settled, we're not necessarily trying or striving to get to any sort of state. But the effort here, and I think the real value of the practice, is just doing it and being open to whatever you might experience in any moment. And that's a very common theme across a lot of these mind-body practices as well. Just briefly, so I mentioned focus attention practices. Another example might be open awareness practices, where you're not necessarily guiding your attention to any one specific element of your experience, but rather you're taking it all in, almost as if you're behind the video camera of your experience. You're noticing your thoughts, your emotions, sensations in your body, sounds in the room, all of these things, and observing them, rather than getting caught up in them. And then the last example is compassion practices, where you're focusing on trying to cultivate a sense of compassion and kindness toward maybe yourself, others in your life, people with whom you might have some sort of difficulty, etc. And so again, focused attention, open awareness, or open monitoring and compassion practices. And I talk about mindfulness first because a lot of these foundations and concepts of experience are very common and can be seen as a foundation for a lot of these different practices. I also want to briefly touch on acupuncture, and in doing so I'd like to recognize that this is not my primary expertise, so I want to be very candid about that. But when we think of acupuncture, again, this is one of those practices that draws a lot of reactions and thoughts and media portrayals and all of these things. But historically, acupuncture was and is a set of procedures that involve stimulation of different parts of the body. So that's the foundation here. In, I guess, practically you could think of it that way. And there are all sorts of different systems in traditional Chinese medicine for what these different points of the body elicit, what their functions and purposes are, and how we can intervene there. And perhaps there are some of you in this room who know more about those practices than I do. And these points can be stimulated through a variety of techniques. The one that's most commonly practiced in the West is through the insertion of very small, fine metal needles. And this has been practiced really historically for many, many years in other countries and has become to be recognized by the World Health Organization as commonly applied to over 100 conditions right now, I think. And so I wanted to provide a little more clarification on how this can be used and applied in different health conditions. And research suggests that it can be helpful in the promotion of health and maintenance through things like prevention of exacerbation of problems as a complement to Western medicine. Again, that term complementary medicine comes in where we're espousing using this practice in tandem with other sorts of interventions as something that might bolster or optimize your current management or health regimens. And mechanistically, there are, in traditional Chinese medicine, a number of different philosophies and theories about how these stimulations can work, but I think in Western medicine, we can think of it as helping with regulation, and helping with regulation of neurosystem activity or neurotransmission, enhancing immune system functioning, and also just enhancing sort of the condition in the region, wherever it's being stimulated, but also in the system or the person as a whole. And there's been research to suggest that acupuncture can be helpful in the treatment or mitigation of symptoms related to a number of different chronic illnesses such as pain, gastrointestinal problems, cardiovascular, respiratory, so we're seeing some different autonomic processes here, and also for psychological well-being. There are actually a number of acupuncturists who specialize in mental health treatment for acupuncture as well. So just a little snippet of acupuncture there. Now I wanted to move on to talking about mind-body movement and some of these different practices. And so broadly, when we think of mind-body movement, we can think about yoga and Tai Chi and Qigong and martial arts, but the real emphasis here and the importance here is that we're moving with awareness. Again, this might sound familiar. We're doing this on purpose, without judgment, and it might be guided by the breath. So the focus here isn't necessarily on what position you can get your body in or what movement you're doing or how you're doing it or how much like a pretzel you can look. The focus really is on becoming aware of how you use yourself and how you move. I also listed mindfulness-based practices here again because it can really be difficult to disentangle mindfulness and mind-body movement because they have such similar foundations and backgrounds. But I want to talk a little bit about some of these practices that I have up here. So yoga, this is another one of these things that we see everywhere now in classes and people walking around with yoga mats on bicycles and all of these things. But traditionally, yoga, the Sanskrit word, I believe it is, the English cognate means to yoke. And what that is referring to is this sort of yoked sense of focused attention and awareness together with a state of steadiness and calmness. And we can think of this as being a pretty lofty goal to achieve. And so from that, and I believe it was classically in India, there were all these sets of philosophies and this whole school and practice and system of thought of mind-body sort of medicine, of which the the postures and movements that we tend to think of as yoga in our culture is just one part. But these were seen as sort of the preparatory exercises to help us get into a state of steadiness and calmness, and again to intentionally use our bodies and physiology. I also want to draw a distinction between fitness yoga and therapeutic yoga, which I think is very, very important, because you might be thinking, in terms of yourself or the people for whom you're caring, I can't do this. And again, the focus isn't on what you do, but the focus is on how you do it. And so therapeutic yoga is really the application of these sorts of movements in medical context, or in the context of health problems. And just a demonstration, our yoga therapist at the Osher Center here at Vanderbilt, a common place that she uses to start is having people sit down and simply breathe in and raise your arm, and breathe out and lower it. The focus, again, isn't on what you're doing specifically, but it's doing this in a way that you're aware of how you're moving, that you're aware of any sorts of tension or stress you might feel. And so being very present to this movement. And by doing so, hopefully we can become more intentional and more optimal in how we move our bodies and how we use our bodies. You might be able to relate with this idea of having your shoulders so high and causing so much stress and tension unconsciously, because it's a habit we get into. But bringing greater senses of attention and awareness, I'm going to hopefully bore you all with those two words by the time we're done, but can help us do things in new, more effective ways. And we can see yoga as being helpful in improving self-regulation, or our own ability, again, to intentionally monitor our physiology, choose how we move, and what we move towards. And this can apply not to just practically physical movements, but also goals and things that are valuable and meaningful in our lives. And research has also demonstrated the utility of yoga in a variety of different medical contexts, and also in aiding in the management of a number of different chronic illnesses, which I won't get into in too much detail right now. I also want to talk a little bit about Qigong and Tai Chi. So Qigong is this larger system of movement that originated in China, actually. Again, this might sound familiar, but it's a movement that utilizes a combination of breathing, focused attention. So they're very similar practices on a sort of thematic level with these movements, and also mindfulness. And these practices were standardized in sort of the middle of last century. And Tai Chi is actually sort of a subcategory, part of the larger system of Qigong. It's the sort of martial application, you might think of martial arts, that focuses on cultivating an internal sense, again, of balance and flow within the practitioner. And that same distinction I made between therapeutic yoga and fitness yoga, or formal yoga, can also be considered for Tai Chi and Qigong, that there are formal practices and very traditional sets of movements in these different forms, and also there's the therapeutic application. Somewhere that our Tai Chi instructor likes to start with is just having people move their hand as if they're punching something, but very slowly, and again paying attention to what that sensation is like, what that movement is like, what you notice in doing so. Are there any emotional reactions you have, or any thoughts going along with that? So a very similar process to what we did in that mindfulness exercise with breathing, but we're doing it with movement. And so now that I've gone through some of those practices in a little bit of detail, I'd like to talk some about mechanisms, or how we think these things can be helpful or meaningful in promoting health. So I want to just briefly refresh you on this model that I talked about, with all these different interactions and these different systems and experiences that we have inside ourselves: our breath, our body, our mind, our behavior, thoughts, and emotions. And also tie this in with this other model, here, this biopsychosocial model, which is sort of the term of art in, I think, medicine and healthcare for how we conceptualize the person in treatment and the systems we find ourselves in. Biological, referring to, of course, biological processes, disease, immunity, our physiology, predisposing factors, genetics, those sorts of things. The psychological aspect of this model, referring to, again, our thoughts, emotions, personality, some might say behavior, and also the social systems we find ourselves in. Our relationships on small levels, and also our communities. Different identities that we might hold dear to ourselves, our socioeconomic status, spirituality, those sorts of things. And we can look at mind-body practice as influencing these different domains in a variety of ways, some of which I've already talked about. One of these is through exercise and movement, and also breathing. So we can help to regulate processes in our body through intentional use of our breath. Likewise, psychologically, with stress reduction, I think the stress reduction can be achieved through influencing our thoughts and our mood, and also socially in terms of the therapeutic relationship. And this is, I think, a key element for a lot of these practices, is that we start looking at the therapeutic relationship, the interaction between patient and practitioner, between student and teacher, however you might look at it, as also an intervention for change. That these interactions can help to improve health in and of themselves and can be seen as part of the intervention. We can also think of health behavior and group effects. When I say group effects, I mean the experience of practicing these different things in a group of people who might be like you, who might be able to relate to your experience. And given all these different aspects, I'd like to talk about 3 overarching factors that I think are very key to how these practices can be helpful to people. The first of these, as I mentioned before, is attention or awareness, by cultivating the practice to guide our attention in meaningful ways. An example of this might be worry or anxiety. If you've noticed that you're very worried about something coming up, maybe it's a medical test, maybe it's some other procedure you're having done, or something that's going on in your life, but you can't do anything about it, then in some sense, worrying, you may be trying to solve the problem, but it's added stress, it's added distress in your life. So helping to facilitate the ability to guide our attention away from things that maybe we can't change, to things that are more meaningful in that moment, but having the capacity to guide our attention. Another thing that I'd like to mention is changing how we react to our internal experiences. So emotional or cognitive reactivity, which sort of goes along with that example of stress or anxiety. But with these practices, we're not talking so much about removing difficult experiences, whether they be thoughts that are unpleasant or emotions that are unpleasant that we don't like, but we're talking about altering how we interact and how we relate to our own internal experiences. It can be very easy for me to say, I don't like this water bottle, so I'm going to get rid of it. I can put it in a trash can, toss it outside, and never see it again. But we can't quite do the same thing with our internal experiences. I can't reach in and find a difficult thought or a difficult emotion and pull it out. But we can change how we interact with those different internal experiences. And then the last thing, and of course these 3 factors are interrelated, is through influencing our autonomic nervous system functioning. I want to talk a little bit about this, and in some ways you all are probably more expert in understanding the autonomic nervous system than I do, but I think than I am. But I just want to, again, highlight and repeat that this is part of our peripheral nervous system that is involved in a lot of these very, very important and sometimes basic functions. And I want to provide a little bit of history on autonomic tone and how we've thought about autonomic tone, because I think that can inform how we see mind-body practices in this context. So a place that I'd like to highlight, again, is the physiologist Walter Cannon, who coined the term the fight or flight response, or the fight, flight, or freeze response as we think of it now, which is sort of this integrated set of physiological responses that animals, is I think what he was initially studying, engage in response to some sort of threat or stress. These things we think of, such as pupil dilation, changes in respiration, muscle tone, all these sorts of things. And this can also be part of our response to stress. And again, we can sort of broadly think of stress as being any response to some sort of demand or change in the environment. And in some ways, that definition is a little bit ambiguous, but it also helps us to notice that stress can be good or bad. We have these terms distress and eustress. So something that might be stressful can be something that engenders a sense of meaning or well-being or greater purpose in your life. Maybe it's the birth of a child, getting a new job, or applying for a new job, moving to a new city for a beneficial or meaningful reason, those sorts of things. While distress you can sort of think of as stress that can't be surmounted through our normal coping mechanisms, through the practices and responses that we already have. And then another thing I'd like to point out is that our stress responses were sort of calibrated for responding to acute things for the most part, to something that is very stressful in the moment and then fades away. And this can become a problem or a difficulty in the context of chronic stressors or chronic illness, in which these habitual responses, these really great systems that we have in our bodies, are responding to something that we might not be able to change through those responses. And so we can think of a lot of our behavior as being habitual. A lot of these things that we do to respond to difficult events. Some of these things can be very, very helpful, and some of these things not so helpful. Some of these things might actually wear us down or run us down or affect us emotionally or physiologically as well. And so another place we can think of mind-body practice as helping in changing some of these things is identifying habits that aren't helpful to whatever we're trying to achieve in that moment and finding others that are more helpful. Again, that awareness, attention, but also doing so non-judgmentally. And then another sort of complementary system we can think of as this relaxation response, which was sort of coined by Herbert Benson, who's actually still living and still sort of a prominent thinker in this area. But his definition of this was this integrated set of physiological changes that we can see when someone assumes a relaxed position in a quiet environment with his or her eyes closed. This might start to feel and sound a little bit similar to what we just did with that mindfulness exercise. So there's some convergence in these different schools of thought about our physiology. But I'd like to highlight, too, and something really important here when we think of the application of mind-body practices in the context of autonomic dysfunction, is that we often think of mind-body practices, mindfulness, meditation, yoga, tai chi, as focusing on relaxing us, on getting us to some sort of calm state. Well, if your dysfunction is maybe in your parasympathetic tone and you're maybe too relaxed in your symptomology, that doesn't really help you. And so I'd like to propose that these practices really can help give us facility and places and ways to intervene to modulate how the system functions. These practices aren't necessarily going to cure or remove autonomic dysfunction, but they can influence how the system functions overall to maybe mitigate some of these symptoms. The example of stress, for example, although stress in itself isn't really a disease, we don't necessarily talk about curing stress, although we might like to. Stress we can see as a byproduct of disease, of chronic illness, of difficult things that we experience. So maybe if we can modulate or change how we interact with those stressors, we might be able to reduce some of those secondary or indirect effects. And physiologically, some of the research suggests that mind-body practices can aid in a number of different areas. One of these is through influencing our heart rate and blood pressure, so decreasing heart rate and blood pressure, which again, depending on your presentation, might not be an ideal outcome. But I think more importantly, these practices can influence our heart rate variability and also barrel reflex sensitivity. So these are these physiological processes that influence how the system works. But if we can increase our variability or sensitivity here, what we're essentially saying is if you can think of these systems like a palm tree, when you think of a palm tree, if there's some sort of wind or storm, that the palm tree might bend, but it doesn't break. And it's that ability to bounce back to different stressors, different difficult experiences that we're trying to facilitate with these practices. And we can see that physiologically as well. And so I'd like to end with talking a little bit about what these practices look like practically in clinical settings, some models for how we're applying these things, and also provide some information that might be helpful in terms of thinking about these things for yourself or family members, those sorts of things. So I'd like to start with integrative medicine, and I'll talk about this wheel a little bit later, but I'd like to emphasize that integrative medicine focuses on holistic care, on the person as a whole, or the system as a whole. And so integrative medicine is the practice of medicine, but again, the focus is on the how. So it's a practice of medicine that focuses on reaffirming the relationship between the practitioner and the patient, or the provider and the patient. Again, seeing this relationship as part of the intervention. So the practice of medicine that also focuses on the whole person, not simply on disease processes or on removing distress, but focuses on the whole person in his or her own unique context. Is of course informed by evidence, and this is something that is growing more and more in these processes in terms of physiology data, electrophysiology, human brain imaging, as well as very important in how we understand the mechanisms behind these practices. And a lot of these systems have been around for thousands of years but haven't been studied in our current context. and also the practice of medicine that makes use of all available and appropriate therapeutic interventions. So using everything that we have that we know that can be helpful in an integrated context. A couple other distinctions is that this model is health-oriented in that it tries to identify and minimize risk through, again, looking at the whole person. These systems or practices are often proactive, so not necessarily explicitly reacting to distress or disease, but trying to find ways moving forward to enhance functioning. And a lot of these practices they're skills, they're practices. They're not necessarily interventions that are a one-off thing, but they're things that the patient can practice and skills that the patient can develop with, of course, appropriate support and implementation, but that can be used throughout the life. So again, focusing on this wheel of health, and this is actually, again, the wheel that we use at the Integrative Medicine Center here at Vanderbilt, but there are a number of different elements and aspects that we don't necessarily think of as being common in medicine. Some of these things might include, religion and spirituality, how the patient finds meaning in his or her life, how the caregiver also finds meaning in his or her life, because the relationship, the community is seen as an integral part of the care for any one individual. We're also focusing here on the environment that people find themselves in, what we put in our bodies, how, again, with movement, how we use our bodies. And also another important element here is daily rhythm and practice. So how we're organizing our lives. Again, the focus here is on how in some ways more so than what. Just to give a practical example, this is what our team, again, looks like at the center at Vanderbilt. So we have, of course, the traditional conventional medicine practitioners or practices such as physicians, nurse practitioners, PT, nutrition, massage therapy, but also, and of course psychology, but also acupuncture, Tai Chi, yoga, Qigong, focus on mindfulness meditation. So we're bringing in all these different practices, all these different systems and schools of thought into one place in a collaborative way such that there really isn't a hierarchy, that everyone involved in the medical team has equal say in communicating with the patient and the family. Some examples of centers are, of course, the Osher Collaborative, the BraveNet Collaborative, which is a larger collaborative across the country that has a number of different integrative medicine centers. And there are also, in many cities, local clinics, oftentimes affiliated with academic hospitals, but not necessarily, where you can find these services. And to end, I'd like to just give a little bit of information or tips that might be helpful in finding some of these programs. So mindfulness, of course, there are formal programs such as mindfulness-based stress reduction, which was developed for aiding in the management of chronic disease or chronic illness. Mindfulness-based cognitive therapy, both of these, again, are formal programs. And the cognitive therapy modification was focused on additionally emphasizing how we interact with and relate to our thoughts for symptoms of depression, anxiety, those sorts of things. There are a number of, for those of you who are tech savvy or have smartphone access, apps that have guided meditations. Actually some experts in this field, both philosophically and research-wise. And also I just have a suggested text here, Full Catastrophe Living by Jon Kabat-Zinn. And again, I believe these slides are all available. Again, for mind-body movement, I'd like to draw a distinction between fitness or formal practice of these schools and modalities and therapeutic practice. Recognizing that you might be benefited by looking for yoga or Tai Chi, Qigong instructor that has sort of a therapeutic yoga certification, or at least examples or experience of working with medical patients. Keeping in mind that there is a difference in how we approach these things with people who have physical or physiological limitations. And a couple of texts there as well, The Heart of Yoga, and also the Harvard Medical School's Guide to Tai Chi. A little bit of information here on acupuncture. One is that it's not typically covered by insurance, but there also is a really great range in the price of these services, from $15 to $20 for a sort of community acupuncture setting, and then up to over $100 per session for a more private, thorough, full consultation. Of course, these practitioners are licensed. That's something that's important to look into. And there's also some sort of incorporation of traditional Chinese herbal medicine. Something else I'd like to point out is that it can take a number of sessions to experience benefit from this practice. And I say that to set expectations that if this is something that you try out, maybe you notice not much is changing. I'd say try it out for 5-6 sessions and then see how you're doing, just to give it time to work and take effect. So I just want to go again over some of these objectives that I mentioned earlier and summarize a little bit. So one, I hope that you all feel a sense of being able to describe mind-body medicine. So again, this is the application and utilization of different techniques that really focus on this interaction between the mind and the body, broadly defined, of course, including things like our thoughts, our emotions, our behavior. But being aware of these interactions such that we can use them and apply them and intervene with these interactions to improve health and well-being. There are, of course, a number of different practices, some of which we talked about, our mindfulness meditation, mindful movement practices such as yoga and qigong, and also some of the mechanisms behind these practices. The three big ones that I think are important to be aware of, again, is how we apply and use our attention in terms of the things that are outside of us, but also our internal experiences, how we react to our emotions and thoughts, and also in the modulation of physiological processes such as our autonomic nervous system. And some treatment settings that I mentioned broadly include the integrative medicine model, but also community and private settings as well, in which we can find these practices and hopefully apply them to improve health and well-being. So thank you all. I think I'm happy to take questions in the panel that's coming up. Yeah, so thank you all.
Thank you, Dr. Savell. So our intention is for this next portion to have a perspective of patients and families who have actually gone through the disease utilizing some of the alternative approaches. Our plan was to have both a caregiver and a patient. The patient that was supposed to participate is Katie Kim. You all met Katie Kim last night. Freddie and Katie weren't able to be here today, and I'm going to give a shout out to Katie and Kim at home that I know are watching, and we're thinking of you and hope that you're doing better each day. But we do have also Larry Kellerman, who you all know, a member of our board, caregiver to his lovely wife Colleen, scientific background, compassionate heart, always looking for ways to alleviate the pain and try alternative approaches. So Larry's going to spend a little time talking personally about their experience with alternative approaches so you can get that feedback. And then together, Dr. Savell and Dr. Kellerman will go ahead and answer questions when he's done. So Larry, you want to come on up? Thank you.
Good afternoon, everyone. Before I start, I just was looking at our Facebook live feed, and we have 1,086 people who have come back on this afternoon. So I want to welcome all of you guys. Welcome. I know some of them are people I've met at previous conferences, caregivers and patients, people who became friends with my wife when she was able to attend the 2 years she made it, and then people that I met those same 2 years, and then last year at New Orleans. So welcome to all of them. And also I want to welcome a special group that I'll explain to you about briefly, and hopefully you've been able to put together a group like this, and that is a group that I call Colleen's Angels. Colleen's Angels were people who were just friends, and they were both ladies and gentlemen. They were people who did not know her before her diagnosis. Before her diagnosis on 3/13/13 at about 3:13 in the afternoon, 5 years after her symptoms started, every one of the angels that helped us after that did not know her on that day. They met her. They loved the smile and the spirit she had, and I think they halfway put up with me. And so it was good to have their help and all the meals and the time they were willing to share. And so I want to tell them thank you for attending and showing up this afternoon. I wanted to share several things that are for the caregiver and the patient. I don't want to go over anything that you've heard already, because so much of what you've heard are exactly the sorts of points of interest that Colleen and I got from our 2013 and 2014 conference attendance, and helped us a great deal. But there are three major areas that I thought I would cover, and then I want to real briefly encourage some of you to do something that my wife did and tell you a bit about what her reward was, where she is right now, I believe, and what she may be able to contribute to the future of multiple system atrophy. The first one is temperature regulation. Temperature regulation, we found early on, was a real issue. You all heard a bit about the sweating and the lack of sweating, etc. And that problem can become exacerbated in a number of ways. One of the ways we found this to be an issue was in the winter of 2013, we moved to Iowa to be close to family members. And if you have not had an Iowa winter day or night, believe me, it's not like Anchorage. There's somebody here from Anchorage, so I do not want to demean anyone from Anchorage. But if you have an Iowa winter, they get pretty bad. And my wife and I were both avid college basketball fans. So because she really couldn't move all that much, we'd set up in the TV room. And over about a week and a half, I began to notice something that was quite unusual for her. She needed me to take her socks off at night and help her pull her sweatpants off before she got into bed. And when she did that, what I found was I put my hand on her left leg, and the left leg was pretty normal temperature. Felt just like you would expect a leg to feel when you're taking clothes off. I put my hand on her right leg, and that leg was like 20 degrees difference, I thought. And me being a science guy and having used nice, strange pieces of equipment in my 2 college classes I taught, I went out and bought an infrared thermometer for $10, and I got this infrared thermometer, and I started using it. And I would say between that time and, say, the next time I went to the doctor, I could periodically take that infrared thermometer, and her left leg would be 91, 92 degrees, about normal. Her right leg would be 71, 72 degrees, a 20-degree difference. Now, I didn't understand why, but I knew that wasn't good. And so we struggled through, read some new information, asked the doctor that we had, and she gave us some advice. And when I went to the 2014 conference, 2 of the doctors that have been here today, one who's going to be presenting in a little while, Dr. Karana, were there, along with a doctor in physical therapy. And so I asked, what's going on? What is this? I don't understand why I'm seeing such diverse readings on my wife's extremities. And they explained that what's happening is she's sitting in this chair watching the basketball game. Just so happens that this one leg is sort of against the wall where this wild screaming Iowa wind is hitting the wall. And the other leg, because of the way the room was shaped, was fairly close to the register for the heater. So the register for the heater was creating a temperature variation for one extremity, and the cold wind was creating a temperature variation for the other extremity. And because the autonomic nervous system was breaking down, the body was unable to react in the appropriate fashion. And he explained to us at that time that what you have is the leg that's warm, because it's by or close to the register, it's registering appropriately. But because the other one is cold, the autonomic nervous system is not able to say, send some blood down there, send some blood down there. It's going to warm the leg up. Your leg needs to be warmed. And since it wasn't able to do so, my wife had these various temperature readings. He suggested using a quilt, and so we tried using a quilt, we tried using blankets, and I'm a problem solver. If I can be anything, I try to be a problem solver. And I had a friend bring over one day an electric blanket. And so we got the electric blanket, and I got to thinking, now, the difference between a quilt and an electric blanket is, with an electric blanket, you can regulate the temperature. And so I began experimenting, and you couldn't put the blanket down on her leg because that was a little too heavy for her, and I think maybe I've heard others say that putting a heavy blanket or a quilt on people's skin and leg can become painful and sometimes isn't tolerated. And so what I did was I tried to make a little tent. I'd put the temperature at 3 or 4 on the dial, and I never had that problem again. And we also rearranged the room so that we didn't have the register blowing on one leg and the wind hitting the other side. And doing some variations like that, we were able to address that particular issue. One other thing that you might find yourself doing as you go through, I'm one of those environmental type guys, that these greenies that you hear about all the time, and I always felt 65 was the temperature in the winter and 78 in the summer, just like Mr. Carter told us in the late 70s. I found you cannot do that with an MSA patient. During the summer, you have to turn the temperature down. And at some point in the last year, I had the temperature as low as 72, 73 for her to be comfortable. In the wintertime, I had it up to 70 on some days because she was not comfortable with the temperature at 65, 68, and it was all about making sure that my patient was comfortable. And so temperature regulation is an issue, and you need to problem solve. And if you need to get an infrared thermometer, hey, get one. Temperature strips might work as well, but those just hit the gun, put it right close to the skin, pull away, do the other one, and you can get a good reading. And they're at Lowe's, Menards, and they're only $9.99. So I'm just telling you, that might be a good tool for you. My wife was one of the about 36%, according to the latest studies, that had chronic pain, right from the very beginning. Pain was a core symptom for her. Pain was in her extremities primarily. She didn't have too many headaches, which I've heard from a number of people here, and I've been hearing on the call line when people call to the call line. Her pain was more in her extremities, and so the doctor addressed it with various mixes of medications, some of which you might have heard of or already on, like clonopin, clonazepam, Neurontin, gabapentin, whatever you want to call those two. And she would set the mix, and she would make sure the dosage was right. But pain was a core issue of hers. Her doctor, in November of 2014, decided to, she'd been doing some reading. She was a young lady. She was about 40. She was a graduate of Stanford. She'd come to Peoria to practice medicine, and she felt strongly that medical marijuana would be a good way to help Colleen deal with the chronic pain. And we had been reading about medical marijuana. There was a study that had been quoted on a PBS radio program about that time about how marijuana addresses a number of issues if you get the right strain. And so she wrote out a prescription. And Colleen was excited. We went down and we got her fingerprints. We got everything done that the state of Illinois required. And then, for some reason, the legislature and the governor decided to have a nice little angry tit for tat, and we went 11 months before they finally approved putting medical marijuana into clinics that we could go to and buy the correct strain. We did not get the first strain and the first treatment until November 9th, which was only 3 months before she passed. She went all that time dealing with the pain and getting additional medications and so on. But on November 9th, when the clinics opened, I was the 13th person in line, and I went in and I'd studied, done all my homework. She had too. She had said, Larry, why don't you just buy a couple of strains or 3 strains so we can try it out? I want to see which will work and what it'll do for me. So when I went in there, very nice scientific individuals. They all were there, helpful, knowing what they were helping us deal with. And they provided me with 3 strains that they felt might be useful for her. I took them back home. They showed me a vaporizer that allowed her to take in only the smoke and not any of the other harmful ingredients. And so we sat down and I said, okay, me being the science guy, let's start documenting. And what we found was there was a strain of the 2 that they had given me that were to help with energy that really worked for her. She would wake up in the morning at that time. This is, like I said, 3 months before she passed. So she was already really beginning to feel the effects of that really mashing that the beast, which Niall Quinn called this disease, was giving to her. And I could give her 3-4 hits off the vape of this one strain, and it would, within 5 minutes, just help her get a nice smile on her face, and she'd sit back in the hospital bed, and she'd be able to be much more relaxed. She'd be able to take some of the friends and angels that would come over, and she felt better. Well, we also found that one of those that they gave me was a good way for her to go to sleep at night. She had trouble, and maybe some of you see this already. You get anxious when you get to bed, and it's hard for you to go to sleep. And Colleen was at that level. She really was not feeling relaxed enough, and so even the medication wasn't impacting this need to sleep. And one of the strains they'd given me was for relaxation. And so we tried it, and for 2.5 weeks, when I would give her 3 or 4 hits off the vape of that particular strain, it was the exact same type of effect that we saw in the morning. She'd sit back and she'd kind of relax, and she'd close her eyes, and about 5-10 minutes later she'd sleep. And she'd sleep 6, 7, 8 hours before she woke up in pain or needed to have her diaper changed or whatever it was that came about. So I found, and I documented, I wrote a short paper about it and put it on my Facebook page at the time, and I still have it. So if any of you are interested and would like to hear, just let me know. But I found that medical marijuana can have an impact. And I've heard from a few others who live in states where medical marijuana is or has been legal longer, who have tried it and used it, and it has a similar effect for them on some of the symptoms that their patient has had. So to me, it's a worthwhile treatment to look at. It has a lot of negative connotations because of the people like me who lived in the early and late 70s and 60s and some of the others. But nonetheless, it has some very positive impacts, I believe, on patients. So it's something that I think you might want to consider. Depression. One of the things that I really struggled with periodically with Colleen was getting down. Now, she was like maybe some of you. Her favorite saying from, I'd say, the end of the conference at Milwaukee in 2013 until the day she could no longer speak was, "I am woman, hear me roar." And that was her attitude. She took that attitude every day. But still, this disease can knock you down. One of the things that I found that was really helpful, it tied back to positive memories in her brain. We talked about it some. We bought a Roku, one of those streaming devices you can get on TV. You hook up and you get all these different channels you can log on to. And she had grown up in the late 50s, early 60s. She was 53 when she started the disease. She was just 12 days short of her 61st birthday when she passed. So she was in that time when black and white TV and just changing the color was taking place. So we talked about, well, do you think you'd feel better if we watched some of those old shows that you might have watched periodically and will click in your brain, or some of those shows you didn't watch? And she goes, yeah, let's try. So we picked a very eclectic mix of TV shows. We watched Route 66. We watched Twilight Zone. We watched McHale's Navy. We watched Combat. And what was cool was, for her, it helped pull her out of that depression, because she could go, I had a 66 Ford just like that. Or those signs, I can remember those neon signs like that. Or, wow, that is so cool. I can remember doing that. Or dancing to that music. Or I can remember that show. And suddenly, what was a negative thought process or a depressive set of circumstances for her became positive, because for some reason she and I had found a link to the positive parts of her memory. And I think when you're dealing with a patient, maybe your husband or wife or family member, and you see this happening, you need to find ways that you can impact positively that deepening or that beginning to slide depression. And that was our way. We love college basketball. Sometimes she didn't want to do that because her favorite team was not a winning team. And so I learned quickly that maybe turning on college basketball at the time is not good, because she'd start getting mad and scream and you kick and, oh, I can't that coach do that. But nonetheless, there were ways that the TV helped positively impact her life. And so I think problem solve, experiment, find out what it is that might impact those negative feelings and thoughts that a patient has, and then go with what works. And maybe it's McHale's Navy, but maybe it's something from the 70s or 80s that might make that difference. I want to say two other things. And one of them is directly related again to these two doctors that you have seen or will see. Dr. Horatio Kaufman was at the 2014 conference in Crystal City, Virginia. Dr. Khurana was there. They made presentations. And afterwards, I think because I was at that time a board member, and they had kind of seen me and heard me and talked to me, and they saw Colleen sitting there, they came over, and Colleen and I talked to them, and they were just so friendly, so nice. And when they got done, they talked to her, and they said, you know what, Colleen, I think I'd like you to donate your brain to science, which we had talked about already, and I'd like you, if you would, to donate your eyes. I want you to donate your eyes. We've got something that we're thinking about doing, and if you would do that, we'd really appreciate it. So we were driving home from Crystal City back to Peoria, and we had some good long discussions, and by the time we got back, she said, Larry, we're going to do it. I'm going to do it. So she got a hold of the New York University Langone Medical Center, found a lady there who worked with us, and when she passed away on February 4th, 2016, the diener at the funeral home came in, took her to the right place, harvested her brain, harvested her eyes, and they made their way to the Langone Medical Center. I got word first of this year because it's pathologists, there's not enough of them, and there's a lot of samples going in, and at the Langone Medical Center they get brains from Alzheimer's patients, many others who suffer from neurodegenerative diseases, and so they didn't get to Colleen's brain for almost 10 months. When they did, and they did the autopsy, they were able to confirm that she was an MSA cerebellar patient, which really meant so much to me because it was important for her that if I was going to continue fighting this disease, that she be identified as MSA cerebellar. That's what her favorite doctor had told her she was, and she wanted to stick to that. She wanted to make sure it was done. About 2 months later, May 18th, as a matter of fact, I got an email. I got an email from the doctors at the New York University Langone Medical Center. Attached to it was an article from the Neurology magazine that was going to come out on June 6th, 2017. What they had done was they had wanted to study a hypothesis. The hypothesis was that the ganglion nerve that runs from the back of the retina to the brain, when it's an MSA patient, that ganglion nerve thins out. Whereas with a normal patient, that nerve basically stays the same thickness. So they had taken 3 women's eyes who were MSA patients and had donated those eyes. A 69-year-old, a 59-year-old, and a 61-year-old. They took 3 women who were of similar age, who were healthy and normal and had donated their eyes. They had done the study, and they found that all 3 of the women whose eyes had been donated, the ganglion nerve thins out for them. And for the normal patient, the ganglion nerve stays at a very similar thickness. It pointed to the idea of a potential biomarker, something we do not have for MSA patients right now. As you know, you're all a probable MSA until upon autopsy. I just got through talking to Horatio Kaufman back there about 3 hours ago and just asked him what that impact means. What it meant to them is they were able to start another trial. It's on clinicaltrials.gov. I just looked it up. If you want to look, you can, and if you feel like when you're ready and your journey is about to end, you'd like to donate your eyes, they have a study going right now. They're looking for people who they can recruit. They have eyes from 100 patients of MSA, 100 patients of Parkinson's patients, and 100 of normal healthy patients. And they are going to try to confirm that hypothesis because, you know, 3 is not nearly enough when you're doing science. If indeed, Horatio just was telling me, if indeed this is proven to be the case, you could go into an ophthalmologist's office. That ophthalmologist can look right into your eye, and within a minute, using OCT technology, they could see if you're an MSA patient a normal, healthy patient, or maybe suffering from another disease that they could point you to. Now, if you think about it, a woman who lived in little old Washington, Illinois, who was a Peoria native, who was just an ordinary PTA, a mother, a grandmother, a heck of a wife, was one that donated eyes that may sometime fundamentally help change the way we understand the disease known as MSA. Now, I want you to know how important it is. Thank you. Thank you, thank you. And when I got that news, I'll tell you, I was out at the farmhouse. I was cat sitting. I was helping Pam, who had a business setting for pets, and I happened to be out in this farmhouse in the middle of nowhere, and I was cat sitting. I'd taken along my computer with all my good blues, and I had my speaker with me, and I just want you to know, I turned it up full blast, and I did the happy dance around that living room. I couldn't believe how important that was for me and for her. And so think about it. Think about donation. The donation of the brain is to help bring confirmation to your family that the disease is MSA or is not. It's also important because tissue is so important with a disease that is so rare. And there's many other tests, potential studies that can be done. And if you happen to decide to contribute your eyes for science, you might want to get a hold of the Langone Medical Center through this clinicaltrials.gov site and make that donation as well. The last piece I want to share with you is Colleen was a fighter, as I told you. And if you haven't read my shirt, it says, the devil whispered in my ear, you're not strong enough to withstand the storm. Today, I whispered in the devil's ear, I am the storm. Rare disease warrior. My wife wanted me to be that. It was one of the things that she wanted me to do. And in the last 6 months, she and I sat down and had lots of conversations. Larry, you know what your mission's got to be. You've got to be able to help as much as you can others who suffer, and I want you to help beat the beast. The beast has got to go down. Well, in the intervening time, and a little bit before that, another board member, one of the best researchers in the MSA field, and I were kind of exchanging emails and comments and so on, and the board member said, well, I want to solve this disease before I retire. I'm a young lady, a 53. I want to solve this disease before I retire. That's 12 years. The doctor happened to be a year younger, and well, he wanted to set the timeline out 1 year. So he was going to hopefully solve it by the time he turned 65. And I looked at their timeline. I'm going to be 77. Now, I'm hoping I'm around when I'm 77. I'm going to work real hard at doing that. But anyway, we kind of made a pact, the three of us, that whatever we can do to help beat this disease, we're going to do before 2029. So when I hear Elaine ask about, can we do a fundraiser? How do we do a fundraiser? When I hear others say, what can we do to advocate or to provide hope? We have to be able to beat this disease. And you've heard so much from all the doctors, from all the medical professionals. You've heard how David started this movement of sorts and has helped contribute greatly to this movement to beat this disease. And we can do it. And it's 2017, so there's still 12 years. We've still got a lot of time that we can work on this. But we want to make sure we beat the disease by 2029. Now, Colleen helped with fundraisers. She helped with a 2014 Blues fundraiser. She helped with a basketball fundraiser. She got 2 weeks to help with any fundraisers, and I couldn't hold any for the year 2015. I've had 2 since then. We have another one scheduled for March 24, 2018, and they're centered around her 2 loves. Her 2 loves were college basketball and blues music. That's what we use. And if you are at all interested, have any connections with people who are college basketball fans or coaches or players or blues bands, blues promoters, whatever the case might be, I'm a willing listener and I work well together with others. Please help us if you can. Thanks a lot. Appreciate your time.
Thank you, Larry. Dr. Savelle, you want to come back on up? So we have about 20 minutes that we can give to Q&A for this session. Again, you've got the index cards on your table, so jot down your questions. Judy will again be making her way around the room to pick them up, and we'll get them off to the speakers here so that they can address your questions. And also, we've got someone monitoring for you guys at home, so if you've got some questions, send them on over. Okay, we're paying attention. Oh, shout out to the UK. Wonderful. Hello across the pond. Blackpool Bouquet. Okay, great.
Also as well, Rita Shoot Moons. I've already seen your name come up from Belgium. World MSA Day is important and big because of Rita Shoot Moons, October 3rd. Thank you, Rita.
Okay. And just a quick note so you know, we know it got a bit warm in here. There was a little tech issue. It's been addressed. It's cooler now, but if it gets too cold, tell us, and we'll address it. Just talk to us, okay? All right, we have some questions here ready to begin? Okay, I'll turn it back over to you guys then.
Hello. Yeah, so the question here is, can you comment on studies that show mindfulness training can enhance neuroplasticity? Yeah, so I guess there are a few different pieces to this, and I'll just start by talking about how we tend to study mindfulness in the brain. And initially started with looking at structure and function in the brain of people who are expert meditators. I think in some cases people who had 10,000, 40, 50,000 hours of meditation. And then also studies looking at responses after intervention. And I guess a few key things that I can maybe say to this question in terms of how mindfulness might help with sort of the function or structure of the brain is that it seems like in mindfulness training we can enhance the parts of the brain that help to, like I was saying, to regulate our thoughts and emotions. So we have more inhibitory control from, I guess, the prefrontal regions of our brain on what goes on in terms of how we respond emotionally to different things or how our thoughts respond to things. So there is a lot of research suggesting how mindfulness might change the brain. I think it's still very much a growing area of research. I think in general with this sort of mindfulness neurobiology work out there, we need to do a lot better in terms of standardizing what we mean when we study mindfulness. Are we talking about mindfulness after 8 weeks for 20 minutes a day? Are we talking about mindfulness for 40, 50 years of your life for an hour a day like you might study in a monk? But I think overall there is enough evidence to say that mindfulness can enhance brain function and can actually change the structure of your brain as well.
And I'd like to add to something that he had said earlier in his presentation about acupuncture. Colleen, before she was diagnosed, and it was in the 3rd year of her disease, we were looking for whatever would work. And so we found an acupuncturist in Peoria, Illinois. He'd been a doctor in China, had escaped China and come over, and he was practicing. We did what you had suggested. We did the 6 sessions. And in the 6 sessions, she would have some relief about the first 24, 48 hours. And by that time, it had worn off. And so then when we go in a week later, it would be for 24, 48 hours, and it'd wear off. So it does help to some degree. It's not a long term, but it does do some good for the patient, and it helps break that cycle of pain and symptomology that they have. So I thought that was a very good part of your presentation.
Thank you.
Yes. Somebody asked a question, if you have brain donation, does it affect the appearance of the body if they are having a funeral and they'll have an open casket? And it does not. They are very good at being able to take and harvest the brain and make sure that it is done in a respectful fashion, so you do not have to worry about that. Now in Colleen's case, she had decided to be cremated, and so her choice was that, and it did not matter in her case. But if you are one who is scheduled to have or would like to have a funeral, it does not. They do not do that. So they're very respectful of what you must consider when you're going through. Maybe you can help in this one because you probably would have a place. One question is, my wife and family members did not ask or ever expect to have to be a caregiver. would you recommend that caregivers take a course in caregiving? What would you say?
Yeah, well, I think we probably both have different perspectives here. Yes, from how I tend to think about it and people who I've worked with who are caregiving for family members, that it's also one of these things that you, in some ways, you have to figure out as your own as you go along. At the same time, courses, I know there are lots of books out there that talk about caregiving sort of more effectively, self-care while you're caregiving. I think in the context of, I think it's Alzheimer's, the 36-hour day is one example of these books. But in general, I think for a lot of people, if you have the time, if you have the ability to take some sort of course, on one hand for the informational benefit, but also for the benefit of interacting with other people who are doing something similar, for the support, for getting some sort of hope and hopefulness in that experience. And you might be able to comment, too, from your own experience.
One of the things that I found is there's some wonderful people who do webinars on the web for caregiving. There's a lady named Janet Edmondson. She has her own website. She provides webinars, I believe, every 3 months. And if you go to there and you watch hers, she does it from the perspective of a caregiver. And it's a very well thought out topic always. She does a 30-minute presentation, and it's very good to watch those to help get some insights into caregiving. Somebody I heard say when the question came up, and they must have heard or seen me get the paper, it was the person who brought it to me, said, church, if you're a religious person, go to church. I'm going to bet that you'd find people there who could help you with caregiving skills, might be able to point you in the right direction, give you some advice on how to care for people. Caregiving is very important, and I think what he said is if you can get a hold of or learn about caregiving, it is a process, and some people can do well learning on their own. Some people need to have help, need to have some advice, and the key, I would say, is be a problem solver. If it doesn't work, try step B. If it doesn't work, try step C. And some point you'll find what it is that works for your particular patient. Okay? You have another one?
I do.
Okay, go ahead.
So this question is saying, are there any studies giving evidence on acupuncture? And I guess there are a couple different parts of my answer to that. There are a lot of groups internationally studying acupuncture and the effects of acupuncture for a number of different things. I'm not specifically aware of groups studying acupuncture specifically for MSA. I could be wrong there. But I think there are a number of different studies going out there. And my sort of background is pain and pain neurobiology, and there, at least in the context of pain, there does seem to be evidence that suggests that how acupuncture works is unique. So it's not expectation only or not placebo only or something like that. But specifically for MSA, I'm not positive, and I'm not aware of any specific research studies going on. That's something that we could use more of course.
And as you can guess, he's saying that exactly, and that is there's so few studies to find out what impacts MSA in a positive way because there are so few patients. So anytime we see people or hear of people doing studies, it's well worth it to try to participate if you can. I had a question on studies as well. Are there any studies for the use of hyperbaric chambers benefiting MSA? I'm like him. I don't really know of any. I can tell you of a personal experience of our former patient representative, Tom Looney. Tom would tell you that for several years he made trips to a hyperbaric chamber where he would go through the very rigid and demanding treatment that those sorts of studies take or those sorts of treatments take, and he would swear by them. He would say that for the next 2-3 months he really felt a whole lot better. He felt like he was more movable. He could do his physical exercises. He did not suffer the way that he might have been just before he went to the hyperbaric chamber. And so an anecdotal piece of evidence would be it might work. As far as a study, I'm not sure. I don't know where we'd find out. Probably do a Google search or a Bing search and see what would be there. Have you heard anything?
Yeah, I think I'd have to say the same thing, that I'm not aware of any specific studies for MSA. I know there are plenty of groups that do study things like hyperbaric chambers, sensory desensitization chambers, which might be some sort of essentially like a compartment that you're in that is very high salt quantity water. So you're floating, it's at the body temperature, so you sort of a almost dissociative experience. But I'm not positive in the context of MSA.
No. Okay. That's such a rare disease. It's hard to find the study.
Right, which is the problem.
Right. Yep.
Another question here is music therapy part of integrative medicine? And then I think on the back here, I think this goes with the question. There's a comment that chant, whether Gregorian, Celtic, all sorts of chant can be helpful in meditation. And I guess I'd say a couple of things there that I think it would make sense to say that music therapy is, of course, could be part of integrative medicine. I think music therapy is something that's being sort of more formally practiced and taught in a number of different settings. There are a lot of formal music therapy programs at different colleges and universities, and people often in music therapy specialize for a certain sort of population or a certain age group. And so I think that's definitely something that can be part of music or part of integrative medicine, and I think in some settings that is an integral part of what they practice. On the comment about chant and meditation, that chant, regardless, or even sound, backing up a step, can be a very helpful part of meditation, whether, as I mentioned, with focused awareness type practices where you're focusing on certain sounds, or you have some sort of mantra or repeated phrase to help guide your attention. Again, it's something that's been used across cultures. We see, Gregorian chant as being part of sort of the early musical spiritual practice in formalized Christianity, and also different types of chant across cultures as well.
I know that there are, and I believe Hadley might be able to say a little bit more if she would like, but that is, I know there's music therapy for Parkinson's, and there are some specific well-known individuals who make sure that therapy sessions are done for those Parkinson's patients, and it seems to be very positive for them. Is that correct, Hadley? It also strengthens the voice muscles if you do that. So music therapy with Parkinson's, it may well be that there are somebody who has been able to get Parkinson's, recruit Parkinson's and MSA patients, and be able to do a study or begin a study. The other type of music I will tell you that works, I hope you don't mind me saying this, but some good blues music, I will tell you. My wife would be sitting in that chair, and on comes a little bit of boogie, and my wife, you could just see the smile. John's been telling me about his encounter with blues music, and he tries to play it periodically, and I'm guessing Hadley smiles every once in a while when he's got his playing going on. But music, to me, helps. There's probably not a study on it, but I think music does help take that spirit and bring it up a little higher. And I think James and his harmonica. Let me tell you, you know it, right? You got it. You got it. You got another one?
I have another one. Do you have one there too?
Yeah. You want to go next?
Okay, sure.
Okay.
So there are actually a couple here that I think are somewhat related. So one is asking about brainwave therapies, another sort of cold laser therapy, or even transcranial magnetics. And I guess I'll sort of answer those as a whole a little bit, that for a number of different conditions we're starting to study non-invasive brain stimulation, which is either the application of electric current or different magnetic pulses. So it's sort of similar there in understanding how that might be helpful in terms of mitigating disease symptoms for pain, depression, certain mental illness, improving motor function even. And I'm not sure in the context of MSA, or if anyone else is aware of that, if there have been specific studies, it would make sense that it could be helpful. I think some of the challenges with those modalities is stimulating deeper brain structures. Of course, DBS is used not uncommonly in Parkinson's. That was mentioned earlier, but one of the challenges with some of these non-invasive or sort of extracranial brain stimulation methods, where there's something applied outside of your head to try to change brain function, is that a lot of times that energy can't get too deep in, which would mean that it might not be able to directly affect structures that we're really interested in or talking about with MSA.
To go along on that, one of the patients who I've met, and I've met his brother as well, he lives in Maryland, his name is Jim Gorman. Jim had found out about that study that you just suggested, where they put this piece of equipment around your head, and they tried to treat it by sending waves into your brain from the external part rather than from inserting something into the brain. And they haven't done the study on MSA. He wanted to see if his doctor would do that study for him with his MSA. Now, he has not told me how well it's gone, but he has, I know, made contact with the doctor and may possibly have already had a treatment or two or be in preparation for. So they are looking at that, and ultimately you may watch at clinicaltrials.gov, or GOMSAR will get a hold of you and say, here's a clinical trial you might want to enroll in that will help us see if that type of treatment will work for MSA. I had one more, and here's one for you, Landry. Okay? I have one more from my side, it looks like, and that is, somebody asked, is there any stem cell research, any trials going on? One of the things that we had in fact, we're expecting, I believe, the paper to come out on the study, but Mayo Clinic just completed a study of stem cell therapy in the beginning of 2017, and they're writing up the final report. They had it at a phase 1 trial, so it was used in human beings, very small population, I believe it was just 12 patients, and they saw positive results. A South Korean trial that ended in 2012 showed positive results, and the impact was on the ability of the patient to function via the Unified Multiple System Atrophy Rating Scale, Part 1 and Parts 2, which they were able to use to do the testing. So if everything goes accordingly, Mayo is hoping to have a large phase 2 trial of stem cell therapy coming up in the near future based upon what the research tells them. So it's something worth looking at. If you believe in stem cell therapy and it's something that you would be interested in participating in, keep your eyes open, watch the literature, watch the websites. Miss Carol Langer.
Yeah, I just want to add a caveat.
Please do.
Which is, what's coming out of Mayo is very encouraging, and I'm wholeheartedly waiting and watching that. Not all stem cell therapy is created equal. So be really careful. Don't think you're going to go, particularly go to a standalone stem cell clinic run by a dermatologist and find a cure for MSA. In fact, you might actually use it. So I'd be really, really careful about how you
Okay, I'll recap that for those of you who are online and for others who might not have heard it. What Carol said, there's a caveat here. You want to make sure that it is a well-designed, thought-out, scientifically valid study that's being done, not one where someone is saying that they will do stem cell therapy and it may be less than scientific, or it may be somebody who has truly science in mind but really hasn't set up the correct protocols. So do be careful when you're looking for that particular set of tests that you'd like to use. Go ahead, Carol.
I would actually extend that to, I actually have gone through some talks on transcranial magnetic stimulation. That, too, is very interesting, very promising for many things. You don't want to buy a transcranial magnetic stimulation device on Amazon, which I actually think you can do, and decide you're going to start doing this at home. You can do some damage.
Okay, transcranial stimulation device. Magnetic stimulation. Okay, so may do damage that you do not want to have done. So be careful with that. Do we have time for his one?
I think,
we're done?
We just want to be sure that you're very careful. We're not advising. We're not promoting. You just want to be very careful is what we want to encourage you. And this conference is intended to provide lots of information, and we've had great knowledgeable experts here, but always, everybody is an individual and unique. Always consult with your own physicians. We have one last question for Dr. Chevelle, so let's go ahead and take that, and then we'll go ahead and have a break.
Yeah, I think this question might relate to the last couple that I mentioned, or could be different. But so the question is coming from online, what about cranial therapy as integrative medicine? So a couple things come to mind. This could refer to some of these non-invasive brain stimulation techniques that I mentioned. And I, again, want to reiterate, as we just said, that I think transcranial magnetic stimulation I think is FDA approved only for depression, is my understanding. I know that's being researched in a lot of other conditions. And transcranial direct current stimulation, which is a slightly different modality. You can think of almost like low current batteries, while transcranial magnetic stimulation is sort of a wand. I'm not sure if that's been FDA approved in the treatment of anything. Both of these are still being researched, and I think very much in preliminary stages. We're not, especially with TDCS, we're not quite 100% sure on what mechanisms might be. So again, these are still upcoming interventions or therapies. On the question of cranial therapy, I think this could also, and I'm not sure what the inquirer's emphasis was, but this could also refer to craniosacral, which is sort of a manual therapy, almost like massage modality, and I think that is sometimes incorporated in sort of manual therapy aspects of integrative medicine as well.
Thank you very much for listening, for all of you who have visited. Appreciate it. I think we have a break next. Is that right? Yep.
Yes. Thank you very much, Dr. Savell, Dr. Kellerman. Thank you very much. Couple quick announcements. So we do have a break, 15-minute break, and then we're going to move into the last segment of the program, which is advances in MSA research. Dr. Vic Corona will be presenting that, but then there's going to be a panel, and the Kaufmans will be back as well, so we'll have room for more Q&A at that time. We do want to remind everyone, please complete the conference evaluations. There is a box outside on the table. Make sure we get them before you leave. And a question came up, is there an evaluation form for those watching the live stream? We don't have one up, but I've confirmed that we will have one up early this week. So jot down some notes. Please, we want to hear from everyone. Thank you.